Hi, Vicky. How are you?
Hi, Flavia. I'm doing great. How are you?
Good. I'm so glad that you could join us today. So this
Thank
is
you
a
for having
segment,
me.
of course, this is a segment that we do for many of our donors and people that have an interest in philanthropy and really just folks in the community in general that want to learn more about what we're doing, not only at the foundation, but what the health system is doing. So we thought, what a great topic to have during Mental Health Awareness Month, than to talk about Jackson Behavioral Health Hospital. So as the leader of that hospital, we certainly want you to give our viewers a little bit of insight as to what's so special about Jackson Behavioral Health Hospital and how are we unique in our position with that hospital in South Florida?
Well, thank you for having me again. So Jackson Behavioral Health Hospital, we are the largest freestanding acute psychiatric hospital in Miami-Dade. I would like to say we're also probably the largest freestanding acute in South Florida. We have 180 psych beds, operational beds. 20 of those are child and adolescent inpatient. And then we have about 15 for substance abuse. And the rest are adult psych, mixed with geriatric. We have a 20-bed geriatric psych unit. And we also have a forensic unit where we partner with Miami-Dade. So we definitely serve a very special patient population that I would like to say no other place in Miami-Dade serves. We are the largest. And then Jackson Health System in general, we make up about a third of all the psych beds in Miami-Dade County. Between Jackson South, we have a crisis stabilization unit in Opelika, the north part of the county. That's another 20 beds. So we serve our community.
No, absolutely. And I think, oftentimes what most people, or I hear in this community when I tell them that we have a behavioral health hospital, they say to me, is that the place where you go when you get Baker acted?
Oh, yeah.
Right?
Yeah.
So we know it's so much more than that.
I want to change the perception. That's my goal, right? I think people view mental health as, all right, well, that's not me. There's still a stigma around it. And our goal is to change that. With the pandemic, what it's taught us is that it affects everybody. Regardless of your race, your demographic, your gender, it affects everybody. So not only do we have the inpatient services, but we also have a full array of outpatient services. I think the stigma and what we want to promote is it's okay to ask for help, and that's just, it's all right. We have services, we have psychologists, psychiatrists, we have social workers. We have something that fits everybody for what they're looking for. Some people just want to talk to somebody else, and we offer that as well. So our goal is to break the stigma, promote ourselves. And I think being part of the Jackson Health System, a lot of people don't know that we're around.
Jackson Health System and the University of Miami are very integrated, right? As the medical academic partner of the health system. How does that work at Jackson Behavioral Health?
We have a very close relationship with the University of Miami. They, half of the faculty, that come over work in psychiatry. Our inpatient units are run by University of Miami. Our CMO is University of Miami. We have a very close relationship. We have it's a large teaching model. We have one of the largest psych residency programs in the nation. We service our residents, there are about 50 or so that service between the VA, and our facility. So it is a very large, robust population of residents, and we work very closely with the University of Miami.
And for emergency services, so there's an emergency room, just like there is at every other hospital. There's an emergency room attached there. So if someone is having a crisis in this community, what should they do?
They can come to our crisis. We have a 24/7 crisis unit. We internally call it our behavioral health ED, which confuses a lot of people because there is no such thing as a behavioral health ED, but we are open 24/7. It's our crisis unit here on campus, part of our freestanding psych hospital. We also, in Opelika, the crisis stabilization unit, it is also a Baker Act receiving facility. So what that means is we have a Baker Act designation with DCF, and there are facilities within Miami-Dade County that when there are patients that need to be Baker Acted, law enforcement or whomever can bring those patients to those facilities. So at Jackson, it's our Community Mental Health Center, our CSU that we call it, Jackson Behavioral Health, and also Jackson South. They're also a Baker Act receiving facility. So our facilities, you can come anytime. Most of our patients, if law enforcement does not bring them to us, they'll bring them to the Jackson Memorial ED. And we just work very closely together.
Sure. And if you are someone at home, can you come in on your own, or do you need to call law enforcement?
Absolutely, you can come in. We do take voluntary, so it's voluntary and involuntary coming to our crisis unit. I also want to promote our national hotline number, 988. That is really the hotline for mental health services, suicide, depression. I know that has been implemented over the last year, so we're really trying to promote that. But absolutely, you can come to anyone who just feels depressed, rather than calling 911, come to our facility, walk in.
And, I've read many times in news articles and even seen it on TV about the increase in issues regarding mental health due to the pandemic and people being isolated and what those kind of, circumstances created. Have we seen an increase of patients here locally, and what are typically the things that you're finding?
So we had seen an increase in anxiety and depression at one point, but it's tapered down. I think for us, because we're very acute, our patient population, that has not changed the volume. With other facilities closing their psych units has impacted us greatly. We've seen the volume increase that way through our crisis center. The number of outpatient appointments, prior to the pandemic, we never did any telepsych. It was always in person. We quickly moved to a telepsych model, offering that during the pandemic, and it worked out very well. So now we offer both in-person and virtual outpatient appointments.
I was just going to ask you about that. So we have outpatient services as well.
Correct. So we have adult outpatient, child. We have a medication-assisted treatment outpatient clinic for opioid use. So we have a full array of outpatient services, and with the pandemic, that's taught us that virtual is okay as well. So we try initially to have, the first-time patients or first-time evaluations come in person, but if they can't, we do offer a virtual session.
That's fantastic. Yeah. That's great to hear. And I know that with the pandemic and mental health being now such a topic that's much more in the forefront, right? You talked a little bit before about the stigma, and I think some of that stigma is going away, which is great news for people to be able to get the help that they need. So we as a foundation decided to go out into the community and create this event called Mind Your Health, which you and your team has been so supportive of. And we found as a way for the community to get behind it, not only to learn about what are the different services available at Jackson, but all of our different partners in the community around behavioral health, and also to help raise funds for behavioral health programs at Jackson. What would some of that funding do? How would that help?
That's a great question. We're so excited about Mind Your Health, and we can't wait for the next one. So the funds help our hospital. We are, our location, we're a public health system. We're located in an urban setting. Our hospital was built in 1999, which seems like a newer building, but over time it's really not. So a lot of that would go through, it's really for, I'm going to give you an example, our patient population. A lot of them are unfunded or have Medicaid. They come in with no clothes, no shoes. Funds like that can help our patients, right? When they're discharged, rather than leaving in whatever clothes they came in, we're able to give them clothes, some toiletries, just basic necessities that they can go home with. We wanted to create a Zen garden or a butterfly garden for our patients. I think a lot of times our patients are in the inpatient setting, they're not allowed to leave. We have fresh air breaks. But again, having a Zen garden or a butterfly garden can help us and our patient population, not just the patients, but also the employees.
Sure.
And so those are some of the things that we would like to do with the funds.
I know that you and I, talked extensively about how do we treat the whole individual, right? So you mentioned the thing of clothing, shoes. They come to us without shoes, or they're leaving, there's no socks. We talked about the pediatric patients, right? Yes, during the holidays, the community is there always donating toys, but the rest of the year when they come, are there activities and things that they can do while they're in their room, things of that nature that we need to be looking at? And always the community, when they're asking, how can I help? These are all things that the community can do to help. Right? It's a little bit different. I think we don't have necessarily volunteers walking into every room like we would, right, at Jackson Memorial Hospital on the physical medicine side,
Right.
but what are things that we can do to help enhance the experience? And I think that's where philanthropy can play a really key role, whether it be like art classes. I know we have a donor that has helped
Yes.
support that program, and our dialectal behavioral therapy program, which is an outpatient therapy program. So
I was just
all of
about
those,
to say
yeah,
that.
all of those different ways are ways in which individuals can help. And we're happy to be able to have those donors that do that, but really look to the community to continue those efforts and grow those efforts, and heck, help us with a new building, right, at some point,
Absolutely.
so we can make changes.
You nailed it with the child and adolescent unit. You walk into that unit and there's art all over. The kids really love that. They're here for a reason, right? They're here as part of their treatment and their therapy. We're engaging them in activities, whether that's art, music, dancing, all of the above. And those are things that these children are really looking for. On our outpatient side, you also mentioned the Dialectical Behavioral Therapy Clinic, DBT. This is a clinic that, it's an intense clinic that serves young adolescents who have borderline personality traits, severe anxiety, and or depression. And this is a clinic that helps them. They have outpatient services multiple times a week. They have art, music, homework. I mean, the psychologists give them all this stuff. So some of the donations can go to that clinic as well to help with their treatment. So there's definitely opportunity, and our patients, they love it.
Part of our goal with Mind Your Health is clearly the fundraising aspect of it is important, because as you mentioned, we're a public health hospital and we want to be able to have as much of the innovative programs and services as we can. But I think there's a greater reason behind Mind Your Health, and it's really to help the community understand the issue of behavioral health issues and mental health issues, help remove that stigma, and really let them know what all the services are out there available to them in the community. For someone that may not be comfortable to pick up that phone and dial a crisis hotline, maybe they'll come out in a kind of festival type setting and really grab some information. Maybe it might be an obscure way for them to take it home with them, really have an opportunity to speak to a practitioner. And then this year we've added the component of the walk and the race. So we want to make it fun for people to come out and enjoy themselves and, form a team and raise money. But really it's all, I think, in the spirit of how do we help continue to remove that stigma and let everybody know that the community can be supportive of each other. So the work that you all have done in bringing forth the experts that will talk about the different topics really, really helped in our first year. And I think as we continue to do it and grow, I'm equally as excited as you are about seeing it come to fruition.
And a lot of those same topics apply now, too. I think when we had the first Mind Your Health, it was in October of 2020 or 2021. We talked about COVID, how that impacted school, virtual learning, anxiety with children, depression in children and adults. So those are still a lot of the topics that apply today. I think, again, going back to the stigma, it's not if you're just severely psychotic and you belong in a mental health hospital. If you're depressed, it's so many different resources that we have that we can offer to everybody, to our community. And that's really what Mind Your Health is, to break that stigma, make it a fun event. I love the 5K component, and interactive. I brought my kids to the first one. They loved it.
Tell us about the partnerships Jackson Behavioral Health has with other organizations like the police department and other entities and bodies.
We have a very close relationship with law enforcement. We are the largest Baker Act receiving facility, which means the majority of our inpatients come through our crisis unit, bringing through with law enforcement. We meet often with all different law enforcement agencies, not with just the city of Miami, but also with the county. And then, of course, the different divisions, especially the one in Opa-locka. In addition to that, we have a partnership with the 11th Judicial Court System. We have a jail diversion program that we work with them on. And these are just those patients who may have a misdemeanor, rather than going to jail, will come to our facility for treatment. In addition to that, we partner very closely with our Thriving Mind partner, formerly known as South Florida Behavioral Health Network. They are a very large community provider. They provide us grant funding and are able to help us with our mission, right, of serving our community. So up in a community mental health center, in addition to the crisis stabilization unit, we have a full array of outpatient services up there that are funded through Thriving Mind.
Have you seen an increase with the increased attention on mental health on a national scale? Have you seen an increase in federal funding and state funding come yet to Jackson Behavioral Health as a result of that?
It's in the works. Not quite yet. I think there is a lot of attention, and attention is good because we didn't have all that a few years ago.
Right.
And so there's definitely opportunity. We meet with our corporate grants department frequently to talk about what's out there. Which are the grants that we want to pursue? So we partner with SAMHSA, which is our substance abuse grant. We have a medication assisted program grant. We have, of course, with Thriving Mind, they provide both our crisis stabilization funding, outpatient services. So there's definitely opportunity out there. It's just getting the awareness and what is it that we need. For our patients, if you asked, I think we're great on the outpatient setting, and there's opportunity to maybe expand. But how do we keep the patients coming from inpatient, right? These are the very sick patients. Why do they come to us? Is it housing opportunity? Those are some of the things that we're working with our leaders and the grants to kind of really provide funding for.
So if someone asked you, what was the greatest need at Jackson Behavioral Health, what would you say?
So we get a lot of grant funding. Without grant funding and philanthropic funding, we wouldn't be able to operate our hospital. Our greatest need is really just having the staff, right? So again, with the pandemic, a lot of people moved to virtual, not just patients, but also you have psychiatrists doing virtual appointments from the comfort of their home. We have social workers that can provide therapy services from their home. So to come and ask them, come to work for a hospital, come work in our crisis unit 24/7, we do have staffing issues, but I think that our greatest need is just the support from the community and keeping our hospital running.
So when we were speaking earlier about Mind Your Health, right, and how excited we are for it, we didn't give folks the date. So it's May the 13th. It'll be at Larry and Penny Thompson Park. And if individuals want more information, they can visit our website at mindyourhealthmiami.org and learn more and participate, and hope that we have thousands of people out there, right, so that they can learn about all of the great services in the community. Vicky, I really wanted to thank you for joining us today. This has been great and teaching me and learning a little bit more about Jackson Behavioral Health. And I hope it was certainly informational for our viewers and for many of our donors. And if anybody has questions and wants to support Jackson Behavioral Health, they can certainly call our office at 305-585-GIVE or visit our website at jacksonhealthfoundation.org. I just want to thank you.
Thank you.